All right. Welcome to another one of the BillFlash webinars. This one is Balancing Revenue and Relationships, the key to effectively collecting past due AR. I will be the presenter today. My name is Peter Hawes. I am the VP of Business Development here at Next Trust. I understand that if we're joining, we probably have some questions. We would just ask that if you could hold till the end. Possibly we'll answer the questions along the way. And if not, we'll have some time available to do that answering of questions. So here we go. So what are we going to cover today exactly? We're going to look at enhancing our practice's revenue by addressing past due AR effectively. We're going to look at navigating the intricacies of collections without compromising the patient-provider relationship. I think that's probably one of the more important topics we'll be looking at today. I know obviously we're here because of the AR piece, but a lot of times it's this relationship facet that keeps us from moving forward with collections. So we'll address that, and then we will look at harnessing the power of transparent communication to strengthen patient trust and the role that trust plays in this whole process. And then we will look at implementing BillFlash's integrated collection service to streamline revenue recovery while upholding your practice's patient-centric values. Okay, so let's get into it. Past due accounts receivable, or I'm going to refer to it as AR a lot, obviously. It can have a significant impact on a practice's financial health, especially since 49% of practices report that days spent in AR have increased. And I'm sure that all of us on the call are very familiar with that. We feel like we're spending way more time chasing revenue. When AR accounts go unpaid for an extended period of time, it can result in cash flow issues and impact the ability to meet financial obligations, such as what? Paying suppliers, employees, creditors. Additionally, past due AR can impact your credit rating and ability to secure financing. Now, if you're one of the 41% of practices that relied on external funding last year, this could be an issue. Revenue recovery in medical practices poses unique challenges, and it requires careful consideration. 74% of providers say it takes more than one statement to collect, and I think we're all aware of that, making collection or collecting past due AR difficult and time-consuming. So here are some of the most common challenges. Number one, patients increasing financial responsibility through high-deductible health plans and co-pays can result in more outstanding balances that need to be collected directly from the patient. Patient responsibility. Effective communication with patients regarding their outstanding balances can be challenging. Patients may misunderstand billing statements or ignore collection efforts. Number two is communication issues. Aging AR, number three. The longer an AR remains unpaid, the harder it becomes to collect. Aging accounts receivable can result in revenue leakage. Technology issues. Outdated or inadequate billing and collection software can hinder efficient revenue recovery efforts. We've all felt this one. The healthcare industry is continuing to face major shortages in staffing, making effective collections difficult. Hiring external collection experts could be the right solution for your practice. Finally, using the wrong collection strategy or not tailoring it to the specific patient demographics that we have can result in low collection rates. To address these challenges, we have to invest in robust billing and collection systems and implement effective communication strategies with both patients and insurance companies. So let's start with a few points on the importance of creating balance between collecting past due AR and strong patient relationships. Number one, patients who trust and have good rapport with their healthcare providers are more likely to respond positively when contacted about overdue payments. So there's that word trust again. Clear and respectful communication with patients regarding their unpaid balances can help in reaching mutually agreed upon payment plans or resolving any billing discrepancies. When healthcare organizations provide multiple debt payment solutions to patients, it becomes easier to address and resolve any issues related to outstanding bills. In fact, 57 or 57.2% of patients prefer to be presented with the option to use a payment plan prior to or at the time of service. And we've known from previous webinars that 90% of our patients want to pay in full and will pay in full if they have the right method of payment available. So in order to proactively address past due accounts receivable and maximize revenue in a medical practice, there's several effective strategies that can be implemented. First, it's crucial to establish clear and flexible payment policies. This means offering a variety of payment methods and payment plans, such as BillFlash Plan Pay. Patients should also be able to easily access payment history and bills through online portals, such as BillFlash's Online Pay, and you can do My Provider link. If you look at the statistic on the screen, 2/3 of our patients, our payers, of consumers prefer online payments for medical bills. 51% would pay more quickly if they received a text reminder. So implementing automated billing systems that send reminders for outstanding balances can help prompt patients to settle their debts quickly. So just a reminder, because we're not going to touch on it in this webinar outside of this comment, the paper bill, the statement, is still an integral part in all of this. It's still the number one way of legally notifying a patient of an outstanding balance in a bill, but it's the text messages and the emails that follow that will generally lead to the payment. Regularly viewing and analyzing our AR reports can help identify any trends or patterns in non-payment, allowing for targeted outreach to those patients who address any financial issues or establish payment plans. And lastly, it's important to maintain open lines of communication with patients, fostering a trusting relationship and encouraging them to reach out with any concerns or questions about their bills. There's that word trust again. By implementing these proactive measures, medical practices can effectively address past due AR, minimize revenue loss, and optimize their financial performance. If you look at the screen now, the 88% of patients with highly positive billing experiences would recommend a provider to friends. We're actually going to talk about that right now in this next piece, which is practicing compassionate collections. In the healthcare field, it's important when engaging with our patients who may be experiencing financial challenges to show this compassionate collection effort. 39% of providers think that billing and collections have no impact on patient experience, which is entirely untrue. And I hope that nobody on this call right now is in that 40% of thinking that the experience is not important. In reality, depending on the demographic we're dealing with, 65 to 85% of patients are willing to leave their practice for a better, more flexible billing experience. So I wouldn't just say that it's important, I'd say it's vitally important. Compassionate collections entails approaching medical billing and payment discussions with empathy, with patience and understanding. It also involves actively listening to patients' concerns, addressing their financial worries, and providing guidance and assistance in navigating the complexities of healthcare costs. Now, before we kind of turn that off, turn a deaf ear to it and say, well, that's not really our job, we go back to the 65 to 85% will leave for a better experience. It is our job. So navigating the intricacies of collections in a medical practice without compromising the patient-provider relationship requires a delicate balance between financial responsibility and compassionate patient care. So here's some strategies to help you achieve the balance. Number one is avoiding embarrassment. When discussing unpaid balances or financial matters, please do so in private or in a discreet setting to avoid embarrassing the patient. Too often we run into it happening at the front desk. Number two, regular communication. Send regular billing statements and reminders for outstanding balances, but maintain open lines of communication for questions or concerns, because there will be some. Three, stay away from aggressive tactics. Don't use aggressive or confrontational collection tactics that can damage the patient-provider relationship. Instead, focus on resolving issues collaboratively. Going back to 90% of our patients do want to pay their bill in full, if there's a way. Number four, patient feedback. Encourage patients to provide feedback on their billing experiences and make improvements based on their suggestions. Balancing the financial aspects of medical practice with patient care and trust requires a proactive and compassionate approach. By implementing these strategies and demonstrating empathy, medical practices can navigate collections while preserving the patient-provider relationship and patient satisfaction. And the satisfaction and the relationship is what brings them back. Effective communication plays a critical role in fostering trust between patients and healthcare providers. Trust is a key element in healthcare. Without it, patients may not disclose the necessary information needed for their treatment, and providers may not be able to deliver the quality care that's required. That trust is so important. But communication goes beyond providing medical care, though. It is essential to building and maintaining trust in collections as well. Patients want to feel heard and understood, and they need to be able to trust that their healthcare provider has their best interests at heart. This requires healthcare providers to use clear, simple language, actively listen to patients, and provide all necessary information and explanations concerning their treatment and payment options. Creating openness and transparency in medical billing and collections not only fosters trust, but also promotes patient satisfaction and compliance with payment obligations. It can lead to more positive patient experiences and fewer billing-related disputes for our practice. So here's a few ways that we can accomplish this. Detailed billing statements. We need to provide detailed and easy to understand billing statements to our patients. Makes sense. Clearly list each service provided, the cost, and any insurance adjustments or payments. And use plain language rather than medical jargon. Estimates, pre-visit billing. Provide cost estimates for planned procedures or services when requested. Help patients understand what they may owe out of pocket. When applicable, offer BillFlash's link pay to allow patients to pay before their visit. Patient portals. Implement patient portals that allow patients to access their billing information, view statements, and make payments online. Ensure that these portals are user-friendly and secure. Regular communication. Keep patients informed about their bills and any changes in their financial responsibility. Send regular statements and reminders for outstanding balances while maintaining, again, open lines of communication for questions and concerns. Using technology to create a seamless collection process is becoming increasingly important in today's healthcare landscape. If you're one of the 75% of providers primarily using paper and manual processes for collections, it's time to start thinking differently. If we're paying all of our bills electronically, if we like to receive things electronically, then why are we still stuck in the paper world of collections? Medical practices need efficient ways to recover the revenue they're owed, and technology can streamline that process. So here are some examples. Online patient portals that we've already discussed, but it offers online patient portals, or we offer them, where patients can view their bills, make payments, and set up payment plans. These portals make it convenient for patients to pay their bills, increasing collection rates. Convenience is the key there. Payment processing solutions. Implement secure payment processing solutions that enable electronic payments, including credit card payments with BillFlash Pay solutions. This accelerates payment collection and reduces manual processing. This could also include things like Apple Pay or Google Pay or Tap to Pay. What the patient or payer is expecting to experience. Revenue cycle management. When it makes sense, RCM can help medical practices optimize the revenue cycle by automating claim submissions, tracking denials, and identifying unpaid claims. It can also generate detailed reports for financial analysis. BillFlash has an RCM service that offers end-to-end financial solutions designed for practices. Automated communication tools. Implement automated communication tools such as email and text reminders for patients with outstanding balances. These reminders can be personalized and sent at the appropriate times to encourage prompt payments. A reminder that our patients, our payers, are not unlike ourselves and will receive the bill in the mail. We know we have to pay it, we set it aside and we forget. And a well-timed text message or email that gets in front of them on their smartphone, which inevitably they will be in front of, will lead to payment much more often and much more quickly. By incorporating these solutions, medical practices can enhance their recovery of revenue efforts, improve patient engagement, and streamline the billing and collections process for past due AR. So, BillFlash Integrated Collections. It's a solution that was based off of responses from practices like yours. In fact, your practice could have been one. When we realized that we needed to offer a solution, we went out and surveyed over 30,000 practices. And the needs that were communicated to us is what we used as a framework to build our solution. We have proven methods that ensure you get paid more, faster. So here are some of the features that come with BillFlash Integrated Collections. Recommendations. You manage the rules that generate recommended accounts for collections during your normal billing file reviews. From the recommendations, you approve which accounts are sent and can withdraw any accounts at any time. You can see all contact activities for every open account, phone calls, letters. You're notified about and approve any write-offs that your payers offer. We're down on respectful. Payers are treated respectfully by our team of recovery specialists who are licensed in all 50 states and receive ongoing compliance training and courtesy coaching. That's a big one. I just want to highlight that one more time. They receive ongoing compliance training and courtesy coaching. I know that a lot of times some of our practices are hesitant to send people to collections because they're afraid of the interaction that our patients, our friends, our neighbors are going to have with the collection agency. Additionally, 75% of BillFlash's recovery specialists are bilingual to ensure language is never a barrier to clean and clear communication with patients. Our recovery specialists tactfully let payers know you're serious about getting paid and use proven methods to bring you higher revenue recovery that beats industry averages. When payers are unable to pay in full for valid reasons, your pre-authorized payment plan options, Plan Pay, will be offered, which gets you payments when none other would have come in likely. Deposits and invoices. Here's where things are different if you're unaware. Collected payments are deposited directly into the bank account used with your BillFlash Pay services. So the collections group does not collect the money and then send a check to your practice for a remainder of a balance. All monies collected go directly through your BillFlash account. And then there would be an invoice sent with related fees. Something very different, which goes back to the visibility and transparency. And as a reminder, BillFlash Integrated Collections is just one of the many services in the comprehensive suite of BillFlash solutions focused on getting you paid. So thank you for joining us as we went over different ways of collecting and doing so tactfully. If there's more you want to learn, you can schedule a demo at billflash.com. Whether you are a new or existing customer, or even a prospective customer, You will meet with different representatives that understand your needs and be able to walk you through the process of understanding collections or anything else that you need to learn.